My name is Jeff Beta with the Sephardic Community Alliance. Thank you for joining us today, and a special welcome to people outside our community tuning in as well. Co-hosting this event with the SCA is the Moise Safra Center and Sephardic Bikor Cholim. Thank you both. And a big thank you to Jack Hidary, who has not stopped working for our community on every level, and without whom this panel could not have happened. The SCA, in addition to our learning programs, Israel advocacy, young adult leadership development, and helping serve our over 45 affiliates from our community of approximately 70,000 plus, we've been in coordination with other great institutions and community leaders that are all doing tremendous work responding to this unprecedented health crisis. Working with our tireless community healthcare professionals, dedicated patient advocates, and our beloved rabbis, we helped educate the public via social media, hosting panels like this, establish COVID testing sites, interface with government officials, and streamlining and coordinating the supply and administration of monoclonal antibodies with Jack Hidary, Dr. Medeb, patient advocates, and other area hospitals, resulting in thousands of people getting this treatment if they qualified under the inclusion criteria. The SCA, along with organizations like SBH, Moise Safra Center, SCC, DSN, and our great yeshivot and synagogues, our community has pulled together in such an unprecedented, beautiful, and generous way. Our brothers and sisters in Israel are part of that coming together in our time of crises. In the midst of the misery that this pandemic has wrought, we have at least that, each other, and that is no small blessing. The eyes of the world today are on Israel as it leads the globe in per capita vaccine rollout. Over half its population have been vaccinated, and 90% of Israelis over 50 have been vaccinated. It's a tremendous accomplishment and a testament to the strength, creativity, solidarity of the Israeli people and its institutions. It makes us proud when we see Israel providing leadership to the world, not just with vaccinations, but in many areas such as human rights, humanitarian aid, biotech, high tech, the arts, culture, and more. Understanding what is happening with COVID in Israel now is being able to read the newspaper from 3 or 6 months from now, but read it today. It's a peek into our future. So before I introduce Sheba and start the Israel portion of the panel, we begin with Dr. Ralph Medeb for a brief update on monoclonal antibody treatment he has been performing here in our community. He has treated well over 1,200 patients in just a few months, perhaps more than any other doctor. I can introduce him by reading his resume, but instead I'm going to tell you a quick story. And you will know everything you need to know about Dr. Medeb. I was very ill in March, hospitalized with COVID. Thank God I made a difficult but full recovery. A few weeks after I got home, my wife told me, Jeff, now that you're feeling better, you should call Dr. Medeb and thank him. I said, Doctor who? She said, Dr. Medeb from around the corner. I said, he's not my doctor. I wasn't in his hospital. Why should what am I thanking him for? She said, he came home every night at 9 o'clock from work. Before having dinner, before with his family, he spent hours every night filling out forms and calling everybody he knew to try to make every possible treatment for me to be available. So at the time, we didn't know each other very well, and now we do, and I'm happy to know you very well. And I'm happy to also have this opportunity for the first time to publicly thank you for the help that you gave me. And I know, having been involved in this, that I'm far from the only one. So Dr. Medeb, I'll pass it to you now for an update on monoclonals.
Thank you. Good afternoon and good evening to our colleague in Israel. And to thank the entire panel, my colleagues here, Grazi and Kasky, for their great work. But the key here is that it's a joint project. I got a call from our famous colleague here, Jack Hidary, for trying to start up a program in Brooklyn. This was back a couple of months ago, and clearly monoclonal was on the radar. Obviously, living through the first round and treating patients on the first round of COVID was a very difficult process. And we saw this as in the forefront of therapy. We instituted very quickly. I think it was a combination of us, Maimonides, the hospital, being able to really convert our fast track emergency room in this fast track area to really a very high-end infusion center where patients would come in. Obviously, everybody meets the criteria, and we're able to really change the course of therapy. I see it as a very hopeful and breakthrough therapy in what was happening in the past. Clearly, the patients will come in, they'll meet the criteria, 65 and over, 55 with some medical issues, or anybody with a high BMI or diabetes, anybody with the known risk factors that progress in a bad fashion, so to speak, with COVID, would able to come in. In the beginning, we were getting CAT scans and blood work to be able to accumulate some data. And within 2 hours, 2.5 hours, they were back home. The average time to feel better by us was about 2 to 3 days. And it was a real breakthrough for what I see as frontline therapy. Not to take away from vaccination, which you're going to hear about a lot today, but we did learn a lot of lessons along, how to get people through, how to get it so that the people are comfortable with therapy, what to expect. And now the major issue that we're addressing is about these variants, which we quickly spoke about. Obviously, the variants are concerning for us because we now know that in our center, we exclusively have changed to Regeneron until the new combination therapy will be available from Lilly, which should be starting next week. What we do find is that all of the therapies that were up to date, are based on sort of like, so to say, custom tailored to the original Wuhan virus. And so we know where the monoclonals will react. We know where they're going to take effect. But what we've seen in the last quarter of 2020, variants that you heard in the news, like the UK variant, the South African variant, and now recently what the New York State has called as the New York State variant, that the Lilly product, the original Lilly product, is totally inactivated. It does not work. One thing I hope to hear from our colleague in Israel is how that would react to vaccinations, because it's a concern. The key here, what we've learned is that these are custom tailored therapies based on our original experience. As the virus will continue to have evolution, we're going to expect some variants, and we're going to have to expect to modify the therapy. What we do know now, in order to keep our patients comfortable, is that Regeneron is still very active. We do know that in the New York variant, the Lilly product is not variant, and we do not use it. We are expecting next week to have the new variant. The key take-home messages at this point, because we don't want to belabor it, is that the product continues to be safe and effective. We are checking for D-dimers to make sure that people are not at clotting risk. We continue to see that if people need CAT scans for other entities, we are checking for them if they have worsening disease. We know who will progress in a bad fashion and who will probably get better in 2 to 3 days. It's very highly effective. The key, again, as we mentioned in our SCA, that's early. Diagnose early, even if you don't have symptoms, come in, because when you get it early, it helps the best. And we will continue to update you on these different variances as we have everyday phone calls about this. And I think at this point, it's very safe, it's local, it's effective. And I want to thank Jack Hittery and the rest of the entire SCA staff, all the doctors and colleagues, and all our advocates who've been pushing and leading this example. I can't take credit for treating the 1,200. The credit goes to Hatzalah, the credit goes to Maimonides, the credit goes to everybody who have pushed everybody to come in and be able to get therapy. So I thank everybody publicly and hope we can continue to do what we need to do. Thank you.
Thank you, Dr. Medeb, and thank you for mentioning Hatzalah. They've been certainly been a tremendous asset, not just here in New York and in Florida, but really in every community that they operate. It's a tremendous organization. I'd like to introduce now our two moderators, Dr. Kasky from NYU. He cares for so many of our community members. Dr. Kasky is also a board member of the Yeshiva of Flatbush. He's advised many of our community schools on proper protocols to operate safely. Dr. Kasky is also an active and valuable member of the SCA medical advisory team. Dr. Victor Grazzi of Mount Sinai is a former president of the Sephardic Bikor Cholim and respected community leader. He's moderated a number of panels on a range of topics from COVID awareness, vaccinations, pregnancy and fertility to medical ethics and Jewish law. He also happens to be my favorite cousin. So moving on now to our Israel panel. Sheba is an extraordinary medical center at the forefront of research and innovation in many fields. They are a leader not just in Israel, but also in the international front through innovations under their Accelerate, Redesign, and Collaborate, or ARC program. and also Sheba's Global Impact Program, an initiative where when a crisis happens anywhere in the world, they think they can help with, they pack up their tents and they go to those areas and help. We've heard governments doing this. Of course, we know the IDF does this, but there aren't many cases of hospitals doing this on their own and without compensation, except for the donors, of course, who help fund the cost of these operations itself. So the people at Sheba are not only great healthcare providers, but also great people and exemplify the great Jewish value of Tikkun Olam. Just this week, and I have to congratulate you, Doctor, for the third year in a row, Sheba has been named one of the top 10 hospitals in the world. And we are excited to be joined by Dr. Eyal Zimlichman, Sheba's Chief Medical Officer. Welcome, Doctor. I will now hand you into the capable hands of Dr. Grazi and Dr. Kasky.
Thank you. Thanks to everybody who's joining our panel. I just want to quickly echo Jeff's words. It gives us great pride here in Chutz La'aretz to know that the entire world has its eyes on this small little state of Israel, which is really truly leading the international brigade against the virus and supplying such critically needed raw data. And I think it's guiding decision-making throughout the world. We're going to ask you please to have your presentation. We look forward to it, and subsequently we'll engage in a conversation, provide some questions that were asked from the audience. Please, Dr. Zimlichman.
ברוכים הבאים.
Thank you, Toda Rabba. Thank you very much for this kind introduction and for inviting me to share the experience of Israel. You know, I think first of all, this is a very unique situation, and I'll try to describe it in the next few minutes as I go through this presentation, where this is the first time ever in the history of the world where we're seeing a mass vaccination program in the midst of a pandemic. This was never done before. It's a tribute to science and knowledge, first of all, and to the success of of science and knowledge in coming up with this solution so very quickly, because I don't think we ever thought that less than a year into this pandemic, we'll have a very, very efficient vaccine. And I will talk about the efficiency of this vaccine. And the story of Israel is very remarkable in that regard. So as I'll take my next few minutes as I walk you through this, we'll start by describing the Israeli healthcare system, because, and I'm sure most of you are familiar with it, but it's important for us to set the stage into why was Israel so successful in doing this. And we'll go through the reasons for that. And then the second part is I'll talk about the data coming out of Israel, you know, the very recent data, some of it just published a few days ago. And I'll say this up front, it'll be optimistic. So there's something to wait for. As we go through, as we go through the facts here, let me start by just saying a few words about Israel demographics. And again, most of you are very much familiar with this. You know, the population of Israel, you know, Israel is a small country, but we have to say, you know, 9 million, just over 9 million is not that small anymore. We always considered Israel to be very, very small. You know, Israel is growing. So we have a total fertility rate of 3 children per woman, which is #1 in the OECD, and Israel is growing very rapidly. And we're about the same population as Austria and Denmark and other countries that we always considered ourselves to be smaller than these other countries. So definitely a growing population, and I'm sure you know about some of these numbers. Also important to note, the healthcare expenditure in Israel is number 28 in the OECD, one of the last ones on the list, with 7.4% of GDP. So the Israeli healthcare system is considered very lean in many ways, but produces very good outcomes. And one of this is the life expectancy being 83 years old for women and men together, #7 on the OECD list. And other outcome measures that, you know, we won't be sharing today, but definitely a healthcare system that is doing a lot with a lot less in terms of resources. And maybe that's also playing a role in the success of this rollout of the vaccination program. As you know, in Israel, we have a national health insurance law, which says that every legal resident receives all medical care. And the co-payment is actually a percentage. It's a tax percentage of your salary, but if you do not have a salary, if you're not making money, then it will cost you 0. So everybody is covered. A single payer system, which of course is different than the US. And medical coverage, as I said, is universal, independent of the employment status, and so on. And there's 4 public sector healthcare funds, which provide all community care services and also insure you for anything that is of course hospital-based or further more than that. Fully digital electronic medical record system, and I'll mention more about that because it plays also a role in the rollout of the vaccination program. Working with only 4 HMOs is a huge plus, and thinking about how complex the US is in terms of the healthcare system. Imagine if the health, if in Israel, the health ministry only has to deal with about 4 entities. And we'll see how that plays in the vaccination as well. So this is how the Israeli healthcare system looks. We have the Ministry of Health, and of course, the Ministry of Finance plays a very critical role in financing this system. We have the 4 health funds, which many of you are familiar with, Clalit, Maccabi, Meuchedet, and Leumit. And then we have the hospitals, and you see some of the numbers. I won't go through the numbers. Sheba is considered, Sheba or Tel HaShomer, as it's often known, is the largest hospital in Israel with just under 2,000 beds. So a big portion of healthcare in Israel is going through Sheba. We see 1.6 million patients a year. We have a very strong footprint in Israel on almost all aspects of care. And we do between a quarter to a third of all clinical trials in the country. They're conducted in just 1 hospital. So in terms of a national footprint, Sheba is major. And also Sheba played a critical role in the rollout of the vaccination program with some other of the large hospitals. But imagine at Sheba, at the top, we vaccinated 10,000 people a day. And this is just 1 hospital. So I think with these types of numbers, you could imagine how how we got to a very quick rollout. Another thing to mention is Israel's health information exchange system. And Israel is one of 2 countries in the world, and the first one, to have the largest connected community electronic patient record. So we have a national patient record for every resident in the country, with 100% of providers connected to one system, whether you're a public HMO, a private hospital, or the army. So if you're seeing, and just to let you know what that looks like, if we have a soldier who was examined in a tent in the middle of the desert by the doctor in the army, and that same soldier the next day appears on our front door at the emergency room at Sheba, we know all about the medical encounter in the tent the day before in the middle of the desert, because it's all linked to one system, and every 24 hours it updates with 100% of all medical encounters in the country. It totals to 11,000 gigabytes of data, which of course is huge, covering over 9 million patients and so on. And this is very, very unique. It's run by a company called DB Motion, which was bought by an American company called Allscripts, but still, of course, it's working within Israel. And we're in a very unique situation. And I'll say in a minute or two why that was critical in this vaccination program. So just to give you an updated look on where we are, this is from 2 days ago. Of course, nothing major has changed. As you see, and as you know, Israel has gone through 3 waves, as we call them here in Israel, of COVID-19. The first one, really at the beginning, when New York was at the center of the storm, Israel went through a very mild course of the pandemic, and you all followed the news. We thought, that was it. Israel mastered COVID-19. We thought we were out of the woods, and for some reason, we're doing a better job than other countries. Then we had the second wave in September around the Chagim, and I'm sure you all followed the news coming out of Israel with the large numbers of patients and mortality. And then we had the third wave coming out of Hanukkah and going through January, which was a pretty tough month here. We're still on the third wave. As you see, we're tapering out and the vaccines are playing a role. And I'll mention also a few words about why we're not seeing a bigger impact of the vaccines, considering the numbers of vaccinated here in Israel. But another thing to note is that the death to confirmed cases ratio in Israel is one of the lowest in the world. We have a lot of confirmed cases, 764,000 is a large number for a population of 9 million. We're ranked at around the number 10 in the world in terms of confirmed cases per population, but the death rate is very low, ranked very, very low on the global scale. Many reasons to that, well before vaccinations, of course. Part of this was, I think we did a pretty good job protecting the elderly very early on. We understood that we need to protect the elderly, and we're quite successful with that. We know most of the mortality, of course, was coming from populations over 60 and so on. And this was a major issue in Israel, protecting the elderly population, nursing homes, and others. But also because of the healthcare system in Israel, which is considered very good. And at any point, the healthcare system wasn't overwhelmed. Nothing of the pictures that we've seen coming out of northern Italy, and sometime, early on in New York during, March and April of last year. That, never hit Israel. And so we were always in capacity to make sure that the healthcare system can provide the best care to patients. And that's why mortality was kept fairly low. So that's another thing to note. And this is the vaccination rates. And I'll get back to this graph later on. But as you can see here, out of 100 people, we're already vaccinating close to 90 per 100 people overall. This is the doses administered. Of course, people need to get 2 vaccines, but close to 90, or I think over 90 now, of doses per 100 people, which of course is #1 in the world, as you can see, with the UAE coming in second, and then United Kingdom and United States coming in third and fourth, but really well below the numbers in Israel. So why was Israel so successful? And this was making a lot of headlines. This is from the Washington Post, but I think it was on the New York Times and almost everywhere, where Israel moves to head of vaccine queue, offering Pfizer access to country's healthcare database. And people were even concerned about this. They were saying, so what's the deal? We're giving the pharma companies now patient level data, and this is not really by regulations, and what is Israel doing? And there's all these issues, of course, of ethics and so on. So I just want to make sure everybody understands we're not providing the pharma companies patient level information. We are providing, not the pharma company, but the world with data on what vaccines actually are capable of doing. This was something that Pfizer, I have to say, and give them the credit, understood very early on. They said, we have an opportunity with a small country that has a very strong logistic backbone, and you'll see it in a second, that have a very organized healthcare system. We have an opportunity within 2 or 3 months to get most of the country vaccinated, and then watch and see what that does, not just to the healthcare and the population health and so on, but also on the economic level, also on the mental health level, on many, many levels where this pandemic is impacting us. Let's make Israel into a case study. We many times in medicine, we have case studies per patient. We have maybe a case series looking at a few patients, but this is a case study of a country. Again, never before done, and I think will be studied for the many years to come, and we're going to learn a lot from this experience. And you'll see in a second why Pfizer actually made the right choice with the data coming out of Israel, and providing this glass crystal ball into the future of other countries as they get to the same vaccination rates, and we can learn a lot from that. We talked about the supply chain and the operations of handling such a mass operation, and Israel, of course, is much smaller. The size of New Jersey, you all know the size of Israel. Can't compare it to the U.S., of course, and that's again one of the reasons why we're so able to roll this out very quickly. But watch this. We have the vaccination manufacturers. The vaccines, the Pfizer vaccines, are kept at -80, which of course is not an easy feat, especially on a mass vaccination program. But then when the vaccines actually make it to Israel, they are placed in only 2 storage facilities in the north of the country and in the center of the country. Only 2 facilities for the entire country. And then from these 2 facilities, they roll out to basically 4 HMOs. The rollout is done on 2 to 8 degrees, the distribution, and we have 120 hours of shelf life to make sure we use the vaccines. And one of the things that you want to track and follow is what's your success rate in actually being able to have those vaccines make it into somebody's arm rather than being thrown to the trash because you've passed 120 hours. And we were quite good at doing that as well. So the HMOs are still doing a great job in terms of putting together main locations, outreaching to nursing homes, outreaching to even individuals who are immobile and can't leave their houses. We're going out to reaching out to them, making it into their houses to do this, to put the vaccines, community practice and centers, and also the major hospitals like Sheba played a role. As I mentioned before, Sheba itself, at the peak, we were vaccinating 10,000 a day, which of course for one hospital is a huge number. So the operation was definitely, the supply chain was definitely handled very well. It still is handled very well. And the reason for that, part of the reason for that, of course, is how healthcare is being organized in Israel, which is very different than the US, of course. We had to go through these prioritization of who gets it first. We had a tier 1, tier 2, tier 3, tier 4. But note this, early February 2021, every person in Israel over the age of 16, and the reason it's only over the age of 16 is because we don't have evidence below the age of 16 for children. So nobody's doing that yet. We'll get there once we have enough evidence from clinical trials. But every person over 16 from early February is eligible for the vaccine, which of course is really ahead of any other country. I know in some of the states in the US, they're still only vaccinating over 65, or if you have comorbidities. But in Israel, already early February, a month ago, we were vaccinating everybody. Everybody that wants to come up and get a vaccine can come up. And one of the things that really helped us to do that is the electronic patient record, the national patient record system that I mentioned, that everybody is linked to. It was very easy for us to understand who's tier 1, who's tier 2, based on comorbidities because of the records that we had. And then you would get a text message on your phone that says, come in tomorrow, 10 a.m. to this and that address, which is right next to your house, and get a vaccine. And if that time doesn't work for you, contact this number and schedule another appointment. And of course, most people, when they get a time, they just go and do it. And that's how we work. Very, very proficient, very easy. Much of this is based on medical data. And of course, the fact that we have this medical data that's very easily accessible on the click of a button also made us perfect for demonstrating the value. And again, that case study that I mentioned of making Israel a real-time case study, and you'll see the data coming out. And the last thing I want to say about what's making Israel special is the sense of urgency. And I think there's a lesson here for every other country in the world. Israel knows about a sense of urgency. Unfortunately, most of our sense of urgency comes from man-made disasters, not pandemics or nature-made disasters. But we do know how to mobilize. We do know how to all align behind one cause. And once we realized in Israel in December that the only way to get out of this pandemic, to get out of this catastrophic period we're all in right now, the only way out would be through vaccinations, we made a national decision that we're focusing 100% on the vaccination efforts. And we got everybody out to start vaccinating, and I've shared with you what we've been doing. And I'm not seeing this with other countries in the world. And I think this is a lesson for everybody, for us. If we want to get more effective on the vaccination efforts, let's get mobilized. Let's get everybody to do this. If you have to mobilize the army, mobilize the army. If you have to mobilize the National Guard, mobilize the National Guard. Get everybody out vaccinating. And this is exactly what we've done in Israel. And I think our ability to mobilize has helped us in that fashion as well. So let's look at the numbers now that we understand maybe why Israel was so successful. We've seen this before, but another way to look at this would be the vaccines per day on a 7-day average, as you can see here. So what's the capacity? How much able are we in Israel to master a huge effort and come up with a large number of vaccinations? And you see, again, compared to other countries, and of course there's, we've seen ups and downs in how we're able to do this. But, you could see here, we were able to vaccinate more than 2 per 100 a day at the peak. And we still have that capacity. The only reason we're not there yet right now is because we've got through almost everybody that was very excited to get vaccinated. We're now towards the end, where you have people that are saying, well, I don't know if I should get vaccinated, or you have people that actually believe any kind of vaccine can harm you and will not get vaccinated. You know, that's always about 2 to 5% of the population. We know they won't get vaccinated regardless of what we do. But the idea is to get everybody else vaccinated. And we're now at a point where we have a very strong campaign out to get everybody vaccinated. And the data actually shows us how important vaccination is. And of course, I'll relate to that later on. So the current status, well, this is from about 10 days ago. You see about 4.3 million who already received the first dose, 2.5 million the second dose. The numbers are actually higher now. We're closer to 3.5 million on the second dose and 5 million on the first dose, and which means that more than 90% of people over 60 already are vaccinated. As you know, this is the population that is most vulnerable to severe disease. And so we think that we're at a point now where, you know, the vaccination efforts are well on their way to making a huge impact, and we'll talk about that impact. Also, persons over 50, close to 90% by now. And of course, we're working on the younger ages right now, trying to get them out to get vaccinated, but I think we're doing a good job with that as well. When I say we've vaccinated about 50% of the population, the total population, that also includes those under 16 who are not eligible for vaccination, as I've said before. So if you take them out, we have about 70% vaccination of the entire population of Israel over the age of 16, which is a fantastic number, of course, well ahead of others. And what kind of an effect that's making, we can look on different data models. This is coming out of the Weizmann Institute, showing us if you look at population over 60 and population under 60, then we're starting to see it's reacting and acting very, very differently. The over 60 are the blue line, and you can see the blue line is acting very differently lately from the orange line, which is the under 60. And the only explanation for that are the vaccines. There's no other explanation for why they're behaving so differently. They haven't behaved differently before this. So a clear indication something is happening. Also, when you look at specific cities and you divide cities in Israel into cities that have a high vaccination rate versus cities with a low vaccination rate, you can see it here that when you compare those, the late vaccinated or the early vaccinated city, they look different already. Again, the vaccines are contributing to that as well. So again, another indication for the effectiveness of the vaccines. But this is pretty early data. If you look at effectiveness data coming from the two largest HMOs, Maccabi and Clalit, you see the numbers. In Maccabi, in the fully vaccinated, only 0.06% are infected, while in the unvaccinated, it's 1.7%. And that means 96% reduction. The interesting thing is that this number is very similar to the number that Pfizer had on their clinical trial, which means they're probably right. You see the same result when you're looking at real-world evidence on millions of patients as you see in the 40,000 patients they had on the Pfizer trial. So, which means this is probably the right number. Clalit, again, very similar numbers, larger, and you'll see this in the publication because this was released in February 13, but 2 days later made it in the New England Journal of Medicine as the opening article on the New England Journal of Medicine, which is the #1 medical journal in the world, just less than a week ago, showing the same numbers, of course, out of 1.2 million insured people, half of them vaccinated, half unvaccinated, 94% decline in symptomatic infections, and 92% decline in severe disease, which of course, again, is around the same numbers we're seeing with the clinical trials and with the Maccabi numbers. And you'll see it from the Ministry of Health. And this is from that publication I mentioned less than a week ago. Last Thursday, it came out from Clalit, the largest HMO in Israel. And again, you're seeing here the unvaccinated on the red, the vaccinated on the blue, and those numbers are looking pretty much the same when you talk about cumulative incidence or when you talk about death due to COVID-19, the same numbers of over 90% effectiveness on a very, very large population in Clalit. And this is data coming from the Ministry of Health from about 3 weeks ago. Again, same numbers. You see here, we're talking about 95%. Also, when you talk about preventing COVID death, look at this, 7 days from those two, it's 95%. 14 days from those two, you even get it higher to close to 99%. It's almost to the fact that if you are vaccinated with 2 doses with the Pfizer vaccine, because that's what we have in Israel, if you wait 14 days after the second dose, you almost to a point where you cannot get infected and you cannot die from COVID, which is almost absolute protection. I don't think any of us thought that it would be so successful. And this is a publication that came out of Sheba and was published on The Lancet about 10 days ago. And you can see here what we're actually looking to see is, when is the effect kicking in? Because a major question was, do we need the 2 vaccinations, or maybe just 1 vaccination is enough to get us protected? What we're seeing here is that 1 vaccine is probably getting us close to about 85% already, 85% effectiveness. You get the 2 vaccines, you get to 95. Of course, 95 is preferable, but if some countries don't have enough vaccines, it is something to consider maybe to only deal with 1. Of course, if you have the opportunity, get the 2 vaccines, get the over 95% protection that they can offer. So the conclusions, we're talking about, first of all, in Israel, high coverage of population at risk. We're at a point now where we're dealing with, I would say, the more stubborn population, younger, healthier. You talk with somebody who's 17, 18 years old, they say, why should I get vaccinated? Because if I get sick, it'll be a mild disease. Why should I, consider a vaccination? We think they need to be vaccinated as well. And I'll say a few words about the variants in a second. Ultra-Orthodox, we're getting them vaccinated. We've done a lot of efforts in that in Israel, but also the ultra-Orthodox in Israel are now getting vaccinated in large numbers. Sheba went out to Bnei Brak to get mass vaccinations in Bnei Brak, in the yeshivas. I can tell you it was a huge success. So we're getting to them as well. UK variant predominant in January. In Israel right now, all COVID is UK variant. More than 90% of COVID cases in Israel right now are UK variant. So we're seeing all this success on top of the UK variant, which means the vaccines are effective, completely effective against the UK variant. There is no proof or scientific publication that says that, but I think evidence coming from Israel can say that for sure. Substantial decline in severe disease in persons 7 days after second dose. We've seen it. Effectiveness analysis, we've talked about that. And fully vaccinated across all the age groups, we've seen the numbers of over 95%. And just to finalize, I will say one other thing about the variants, and of course, happy to follow up with questions. Of course, we don't know enough about the other variants. There are concerns. There's a South African variant, which we think is okay with the vaccine. We're pretty comfortable with that. But there's a Brazilian variant, which has more question marks. And so, of course, we need to wait and see more of the data. We don't know. And as long as we don't know, we need to be cautious. And that's why the policy here in Israel is even if you're vaccinated, you still go around with the masks on, because we don't want to take any risks. So I'll finalize with this. I don't know if you know this, but Bibi was vaccinated at Sheba. This is my boss, Sheba's CEO, Professor Yitzhak Kreis. And Bibi he was the #1 person in Israel to get vaccinated. Our CEO was number 3. I was number 150 in the country. That's also a small piece of history, but it rolled out at Sheba on December 19, and it's really been a whirlwind of vaccinations ever since that date. And Sheba was really at the forefront in terms of the efforts to vaccinate everybody. So I think I'll stop here, and of course, I'm happy to continue the discussions.
Just wanted to say, really, it's an honor. It's a great talk you gave. It's an honor to be collaborating with Sheba, a world-class institute. Also wanted to shout out to the SCA, SBH, and of course the Moise Suffer Center, and also my wife, who also was instrumental in trying to collaborate with the different institutions. So great talk, very reassuring. I'm very excited about the data that you presented. It makes me feel good about it, about what we have coming out in the future. So just starting off a little bit, wanted to ask a little bit more about the vaccine and what your thoughts are. So first of all, how much of this data do you think you can extrapolate, number one, to Moderna? And secondly, how much, we have the recent data from the Johnson & Johnson vaccine, that just became available in the US, and a lot of patients are asking if they should take it or not. It seems like the Pfizer, based on your data, is probably, based on what you have now, has excellent data. So what are your thoughts about the others?
So it's a great question. We have every reason to believe Moderna would provide just the same results. I don't think it'll be any different. So, Moderna and Pfizer, same methodology, very similar in terms of the design of the vaccine, messenger RNA, of course, based. We can assume that we would see the same results from Moderna. And this was a huge success. And I'm sure you probably share the same sentiment, because a year ago, we didn't know much about the mRNA vaccines. This is completely new. Moderna was a small company that had this idea, right, of having vaccines made out of messenger RNA that you can package. This would be a Nobel Prize for sure. We already know who's going to be the Nobel Prize winner on that one, I think. But this is a huge success of modern technology and modern science, to have a vaccine that I think, and I didn't speak at all about side effects, I'll be happy to follow up with a question on that, to have a vaccine that's very safe, very effective. And another thing to note is easily adjustable, because as you know, with the variants coming out, both Moderna and Pfizer can make very small adjustments to make sure a new vaccine coming out in a month or 2 months or 3 months from now would include the variants. So we should be very optimistic about this technology. And obviously, I think this would be a new way of making vaccines in the future on all fronts, not just on the COVID, of course. The Johnson & Johnson uses the more traditional methods of vaccines. The other ones as well. We have an Israeli vaccine as well. Some of you might know it should be coming out in the summer. And that's also based on the traditional methods. And they would probably be effective. We know the data as well. But I think if I have to, as a scientist and as a physician, if I have to say the big news is that the mRNA works better than we expected.
Do you think it plays a role, the Johnson & Johnson? Because, based on the studies, 65% efficacy and 85% in preventing more severe disease. So patients that get it might just get a mild case, but they have an 85% of not ending up in the hospital with severe disease. Maybe in places that they don't have access to, the vaccine in that large quantity.
Right. I mean, definitely, I think the first priority for each one needs to be get vaccinated as soon as you can. Regardless of which vaccine it is. I mean, if it's got an FDA approval, use it. Because you could always actually get vaccinated later if we find, if we have comparative trials and strong evidence that shows one is superior to another, and we have mass productions later on, a year later, we could decide that everybody will be vaccinated only with one. That would be found to be, superior to the others, comparative effectiveness and so on. But at this point where the pandemic is raging, the first priority is get vaccinated. And, if you have Moderna or Pfizer, you get vaccinated with that. If you can't have access to that and you have the J&J, you get vaccinated with that as well. Is obviously much, much superior to not getting vaccinated.
I think the data is really compelling about effectiveness. And many people will absorb that and be amazed by it, but have some concerns about side effects. So I remember when the vaccines were first released, the lead story in the national news was 2 nurses developed an allergic reaction in California that didn't require hospitalization, but we were amplifying concerns at the time about side effects. So I really haven't heard much since that time. Can you share with us your experience? Because I believe the lack of serious side effects will be as encouraging as the effectiveness data. But that hasn't really been discussed much, at least in the public media.
Right. So we haven't released, Israel hasn't released any data on, official data on safety. I can tell you, what we as the science and medical community here in Israel see. We're not seeing side effects. This is much better than we anticipated. We're seeing very, very minor. I mean, I could share with you just, people around me who were vaccinated. Typically, it's maybe after the second vaccine, you have maybe 24 hours of, general weakness and maybe a low-grade fever. That's about it. We haven't seen, and even if we have seen incidents of, and somebody says, well, I know somebody who was vaccinated and then had a heart attack the next day. But those are anecdotal cases. Who knows if this guy wouldn't have had an heart attack regardless of the vaccine? Because if you vaccinate millions of patients, you're bound to see somebody who has some incidence of a medical event after the vaccine on millions of patients. But there is nothing to link it to the vaccine itself, to the vaccination. And another word would be critical with pregnant women. It's critical as well because as we started this, because the Pfizer and Moderna trials did not include pregnant women, then at the beginning, we weren't vaccinating pregnant women. It took us 2 weeks to understand that this was a mistake. And we first said only vaccinate on the second and third trimester. And, because we realized that the first trimester, there might be potential harms to the embryo, and so on. We know this from other medications, for example. But after a few days, we even said you can vaccinate throughout all 3 semesters. And the reason for that is because maybe we're seeing, and again, there's no scientific publication, so as physicians, we also always have to be cautious a bit. Maybe we're seeing that the variants are having a more severe course on pregnant women. In Israel, we have a fairly large number of pregnant women who were not vaccinated and are in severe case in the ICU. Some of them ventilated, some of them on ECMO machines. And this was not seen on the first 2 waves of COVID in Israel. It's only seen on the 3rd wave, and we're assuming maybe it has to do with the UK variant. So once we realized that, we said, even if you're pregnant, get vaccinated, because the risk versus the potential benefit completely outweighs the risk. There is no reason why the mRNA vaccine should have a adverse effect on pregnant women scientifically. And that's why it was a clear-cut recommendation.
We've had the same experience here lately in the States. Back in March and April, we had a very, very high rate of positivity, but very little clinical illness. Now we're seeing a lower rate of positivity, but a much higher rate of clinical illness. And in fact, it's anecdotal, but we have a patient in the ICU who just developed COVID while pregnant. The tide is shifting here as well. I believe that in the studies that Pfizer and Moderna, even though they didn't specifically recruit pregnant women, they clearly had a subset of women pregnant who were in the study or became pregnant over the course of the study. And the data that's come out of that from what's been shared here by the academic OBGYN societies has also been reassuring. So I think the data is developing. It's in a state of flux. And New York State actually has added pregnant women to the list of those who should receive prioritization in terms of vaccination. So I think that's an important message for us to get out.
Just to also tie into monoclonals, we're recommending in certain cases, as Ralph, we've discussed in the past, even for pregnancy, it's sometimes.
Yeah, at first we were worried, and clearly after speaking to Dr. Grazi for sure, but other doctors down in Jersey Shore, they made a huge push to consider, even called Eli Lilly and Regeneron themselves with the Department of Health to classify pregnancy as sort of like this immunosuppressive state and give them the ability, because we see the same thing. pregnant women in the second, third trimester getting very sick, and postpartum women between the first 4 to 6 weeks with huge scans. I mean, CAT scan proven huge infiltrates on the viral pneumonia. And so we've been very lax in changing that first, early on in November, December to what we do today. And we put them either on the BMI criteria or the immunosuppressive state, and we're seeing a big difference.
I think that a good opportunity to tie the issue of monoclonals together with vaccines, because some of the questions we've had is we know there needs to be a delay in administration of the vaccine after someone's been treated with monoclonal antibodies. What's the state of the art here in the States? And Dr. Zlumichman, if you could address that in terms of the Israeli standard of care as well.
Well, I have to say this is something that's very interesting. The monoclonals have not really were not captured here in Israel that much. We're not seeing as much a use of monoclonal antibodies in Israel. I'm not sure why that is the case. We're following the studies coming out, and we do have access to monoclonal antibodies. We're using here at Sheba, we're using that as well. I think one of the reasons is, first of all, once we've reached a very high % of vaccinations, the focus was on that. And, once you get huge vaccinations, obviously it takes down the need because for the monoclonals, because, monoclonals are there to provide you, to make sure you're not developing a severe disease, early on in the course of after contracting the virus. With the vaccines, what we're seeing is that if you are developing the disease, it's a very, very mild disease. It's very, very mild disease. I mean, we've seen people here contracting COVID after being vaccinated, even 2 weeks after the second vaccine. It has happened. We've seen these numbers and they're not that rare. But in every single case, almost, I think maybe 1 out of 10,000 infected who have been vaccinated actually developed a severe disease. So it's not just preventing the contracting the virus, but it's preventing for sure a more severe course of disease. And again, we're not seeing a huge amount of use of the monoclonal antibodies here.
Right. I think the general consensus here, just for the audience, is that after receiving a monoclonal, so if you have been diagnosed with COVID and you meet certain of those criteria, and you're a candidate, so we would recommend to get the monoclonal antibody infusion. We usually recommend that you hold off on getting the vaccine for about 90 days. Generally, because there might be some effectiveness if we give the vaccine earlier and some interaction. So generally, we would hold off on giving the vaccine for 90 days because that was a big question that a lot of people were asking. Just to go back to side effects, just because I've been getting a lot of questions. We understand the short-term side effects are minor. Do you have anything that you're thinking that would cause a long-term side effect? Because everybody keeps on saying long-term. Me personally, I don't think so. But any thoughts about long-term side effects? Guillain-Barré,
Right. Yeah, the only thing we're seeing, which is not long-term, the only thing we're seeing outside of the very mild, events that I mentioned, we're seeing some patients who have, facialis, some kind of neuralgia, which is, self-terminating. So it's a couple of days, 2 or 3 weeks. We've seen some of those cases. So there might be some neurologic, limited neurologic disabilities which pass by themselves. Of course, we cannot talk about long-term because we're not, we don't have enough time to monitor this. What I can tell you is when you do speak with, the scientists that actually work in this specific area, that, work with mRNA, and Sheba, by the way, is one of the leading institutions in the world with mRNA research. And we've had a lot of debates here internally between our, in our staff to make sure everybody gets ask the right questions. There is no reason we should be seeing. So the physiology of this vaccination, there is no reason to believe that there would be long-term effects. It's not something that we expect based on the methodologies and the pathway that this vaccine actually works through. So I wouldn't say it's something to be concerned about. It's certainly not something that should deter you from, from getting vaccinated, but it is of course something we need to continuously watch. And I'm pretty confident we'll find that this vaccine is very safe to use.
If we could switch gears for a moment, the data, as I said, is very compelling. The side effect profile is equally reassuring. Hopefully, we've been able to have some impact on those who've been uncertain about their desire to be vaccinated in terms of encouraging them to do so. But for those who've been vaccinated or plan to be vaccinated, we are a little over 3 weeks away from Hag HaPesach. And a very big question coming up is, I've been vaccinated, my family's been vaccinated, my parents have been vaccinated. We're getting somewhat mixed messages here in the United States as to risk of transmissibility after infection, whether you can change your what you're doing on a daily basis, wear masks, not wear masks, get together, not get together. Some restaurants are open, some movie theaters are open. I think people are grappling with the desire to get together with family, particularly with the onset of the holiday, with a bit of uncertainty as to how safe that actually is. Can you share with us any data or any of your thoughts on that, please? It's certainly timely.
Sure, it is. It's very timely, and it's preoccupying our minds all the time. I can tell you that at Sheba Medical Center, we've had our first seminar, in-person seminar 2 days ago, with people coming in to a large hall. Everybody is still with masks, but for the first time in the last year. And on Sunday, we're opening our cafeteria for people who have been vaccinated. So if you've been vaccinated, if you're a staff member and you were vaccinated, you can come into the cafeteria and have lunch. Again, the first time we're opening that in a year. Of course, we're all grinning and happy about this course of events. In Israel at large, we're seeing now mass openings. And of course, some of you are following the news. Theaters are already working. Sports events, you can go and watch a basketball game. We're still limiting, so there's only room for 300 people in a theater, not more than 300. And you can only come in if you've been vaccinated or if you can show a negative test, PCR or antigen test from the previous 48 hours. And I think this is the way, of course, to also make sure we're providing enough incentives to get vaccinated. They just announced today or yesterday that you can catch a plane if you've been vaccinated, or again, if you show that you're negative in the past 48 hours. So with that, you could stay unvaccinated if you don't think that's the proper thing to do, but you would have tests every now and then to make sure you're still negative, or you can get vaccinated and get back to normal life. We still have people with masks on. So if you're in a theater, you would have masks on. You would still keep social distancing of 6 feet away from each other. But we're taking that as a precaution, obviously, and mostly because of variants which we're not certain about, how they're going to react to the vaccine. But we're looking forward for Pesach. Last year, we all remember how Leila Seder was. I think I'm hopeful this year it'll be very, very different. And there's no reason to believe otherwise. But, we're very, very careful with this pandemic, with this virus. It's mutating. We don't know what's going to happen in a week from now. We should be careful. But I think there's a lot of reasons to be optimistic.
What are your thoughts about CDC put out some guidelines about post-vaccination? If you're 2 weeks post-vaccination and you get an exposure, you don't need to quarantine. I'm interpreting it as that once you're vaccinated, that it's unlikely you're able to carry and transmit the virus to other people. So what are your thoughts on that? And secondly, they only did it for about 90 days. I'm anticipating they're going to probably extend it for a certain period of time after. So I just want to know your thoughts.
So again, we have to be careful because we haven't seen any scientific publication that says 100%, if you're vaccinated, you cannot transmit the disease. And, at some point it will come out. We'll have enough evidence. The evidence currently, the real world evidence is showing us that is the case. if you got vaccinated, the chances of you transmitting the disease are very, very small. But of course, if everybody else is vaccinated, then even if you can transmit the disease, it doesn't have any effect because others would be susceptible, wouldn't be susceptible to it. But again, we need to wait for the evidence. I think it will take another month or two to see a publication maybe on the New England Journal of Medicine that says that for sure. You should still be careful, but again, I'm very optimistic that that is the case.
And what about extending 90 days after the vaccine to 6 months?
I'm not sure about the.
No, they're saying for now, for 90 days, you don't need to quarantine after an exposure. So in general, after vaccines, and this is sort of lead up to the efficacy of the vaccine. Are we saying that after 3 months, 6 months,
Right.
Are we going to require a booster? Is it going to be an annual vaccine?
I can tell you again, the state in Israel. I have my vaccination cards, and it says that it's good for 6 months. So that's what we have in Israel. We're pretty certain that 6 months should be okay. I think personally it'll be longer than that. I think closer to a year. But again, the variants, that's going to be the main issue. We're bound to see a lot of variants. The question is, whether the vaccine would be still, effective against the variants. There's already some evidence that shows that the Brazilian variant, if you were infected with the original strain, you are still susceptible to the Brazilian variant. They don't have evidence about the vaccine. So if you were vaccinated with Pfizer or Moderna, whether you're susceptible or not to the Brazilian variant. But of course, that draws questions. So we need to be careful with that. But I think generally, and I think moving forward, we might be at a point where we will need to get vaccinated maybe once a year, with a new vaccine that covers all the new strains, maybe even every 6 months. And so that's why I think 6 months is a good bet. Maybe even more than that, but certainly 6 months.
I have what may be an unfair question, but it's on everybody's mind. It's unfair because it involves some conjecture on your part. So I'm not holding you to it scientifically. The phrase life getting back to normal. So we're hearing now, I've been vaccinated. I plan on getting together for Pesach with those who've been vaccinated. We practice what we preach. People will make their own choices. But I do wear a mask virtually everywhere, even with others who are vaccinated until this point. So the question in everybody's mind, and we need real data ultimately to give us this hope. But the question is, when can we expect life to be back to normal? As how we lived prior to the beginning of 2020.
And what criteria needs to be met in order for that to happen?
Yeah, it depends what we call normal. Back in May of the previous year, I was interviewed on TV here in Israel, and I said we need to start getting used to the fact that we'll be using masks everywhere. And the fact is that if everybody was using a mask everywhere, we wouldn't have a pandemic. Because it's almost 100% protection. So whether we could do away with masks completely, that might take some time. But I think normal in terms of going to a theater, catching a movie outside, flying on airplanes everywhere with a mask on, I think that's coming around the corner. And I think that will be as close as we can get to normal in the next, certainly in 2021. We don't know too much further ahead than that. There is even some theory that maybe this whole pandemic is winding down. If you look at the overall numbers around the world, they've been on the decline for the past month or so, which we've never had before. So since the start of this pandemic in early 2020, we've always seen numbers go up. There wasn't 1 week where numbers around the world total were going down. And now we're seeing a full month of numbers going down. There's some theories that maybe something is happening, maybe we're coming out, but of course, we shouldn't believe in that until we have much, much more hard evidence. But I do think with the vaccines, we will be able to go back to almost our routines within 2021.
That would be wonderful. Ralph, David, any other questions or comments for the doctor?
I'm good. It was excellent. Thank you very much. Excellent review.
Yeah, I think basically summed up most of the questions. We have to get to that level, and that's what everybody's anticipating. But thank you for excellent data and wonderful presentation.
Thank you.
Thank you very much. And thank you again for the opportunity. And I think I said at the beginning, I'm bringing an optimistic message. And the message is that, the vaccines work. And at least on the short term so far, we're not seeing any side effects that should deter us. So if anybody is watching and can get vaccinated and hasn't gotten vaccinated yet, that's your first priority.
My take-home message is we've all been vaccinated and we're coming to you for Leila Sede.
Great. We'll have you all here. We're now opening Ben Gurion, so
Thank you.
stay tuned.
That's great. All right, thank you, Dr. Zimmelman, for making yourself available for the panel and all the great work you're doing at Sheba. And again, congratulations on being ranked for the third year in a row, top 10 hospitals in the world. Incredible achievement. And thanks to Dr. Grazi and Dr. Kasky for the informative panel, and our co-sponsors, the Moise Safra Center and Adele Kasky for her support there, and SPH, and for everyone who joined us today. And of course, Jack Hittery. And I think, Jack, maybe a few words for you closing it out.
Thanks, Jeff. This has been a really informative panel. Great to have everyone on this panel and getting this message out and getting the data out at a critical juncture in the pandemic. I first want to give a big shout out to Dr. Medeb, who opened our panel today and his discussion of monoclonal antibodies. Dr. Medeb has been tireless in his efforts, literally on a regular basis, up at 2, 3 in the morning in the center, helping patients. And so it really has walked the walk with so many patients. And I want to also recognize Dr. Medeb for his work, not just for this community, but for all communities. My code name for Dr. Medeb's hospital is Abraham's Tent, just like Abraham's Tent was open on all 4 sides and welcomed all comers. So too is Dr. Medeb's hospital in the heart of Brooklyn, a very dense area with many diverse communities. Dr. Medeb has done tremendous work for this community, but also many diverse communities in the Brooklyn community. And that's, I think, a testament to Dr. Medeb's leadership and the leadership of his team at NYCH. I want to thank Drs. Grazi and Kasky for helping to put this together today and for moderating this very, very important panel. And of course, to Eyal, to Dr. Zimmelman, the Chief Medical Officer at Sheba, who we've been collaborating with on several fronts on COVID. It's wonderful to see the leadership of Sheba and also now having the per capita leadership of Israel in terms of vaccinations and seeing that as a window onto our own future in the US and in other countries. This is a very important moment in the pandemic. We have to really focus all of our efforts right now to help people get the vaccine, to help people who do get disease right now to make sure they get the monoclonals on a timely basis, as Dr. Medeb reminded us. It's the timeliness of the monoclonal antibodies that is absolutely pivotal in their efficacy. And also to continue collaborations with organizations such as Mount Sinai, with Dr. Grazi is, NYU, Dr. Kasky is, and of course Sheba in Israel. And it's so good to see this collaboration continue forward. I think we can look forward to a more optimistic near-term and midterm future, as Dr. Zimmelman is pointing to, but it's going to take a concerted effort. Israel did not do this by accident. This was a very intense, coordinated effort on the part of medical doctors and other logistic support and leadership to make this happen. We have to follow this model now and do the same, both in our communities, but also helping those other diverse communities across the US to cross this finish line. Thank you, Jeff and the SCA and all the participating organizations for putting us together today. And I'll turn it back to Jeff.
Oh, I think that sums it up perfectly. Thank you, everybody who joined us today. I hope you found it informative and useful. And again, thank you to all the doctors who joined on the panel. Appreciate it very much.
Thank you.
Thank you.
Thank you.
Take care.